My name is Jessica Young, and I'm a breast surgeon here at Roswell Park Comprehensive Cancer Center. Really, I should first say that most women are at normal risk for breast cancer, but there are a lot of different things that can increase your risk of breast cancer. Most people think, of course, family history is one of them, and that's certainly a big contributor. There are a lot of things that are actually personal to you yourself that might be different than your other family members as well. Things like how many children you've had, when you had them, if you've had any breast biopsies before, whether you smoke or drink a lot of alcohol, your body weight. So there's a lot of different factors. So if you're at higher risk for breast cancer, there are certainly different things that we can do to either help find cancer sooner or also help reduce your risk of breast cancer. So one of the first things that we can do if you meet a certain risk level is that in addition to doing a mammogram once a year, we can also add an MRI for screening as well. So a mammogram and MRI, when you put them together, they're really great at finding breast cancers, especially at an early stage. So that's one of the things that we can do. And then there are other risk-reducing things that we can do as well to help reduce your risk. So things like not smoking, encouraging less alcohol intake, so less than 1 drink per day, try to maintain an ideal body weight, increasing your physical activity, those are good things, and then not taking hormone replacement therapy when you're postmenopausal. So all those things we know can help reduce your risk of hormone-positive breast cancer, which is the most common type of breast cancer. So Roswell has a program that helps to identify women who are at higher risk for breast cancer. So if you think you're at higher risk, you can certainly apply to the program and we can assess you for that. So one of the nice things is that some people come through and they find out they're actually at normal risk for breast cancer, which is fantastic. That could be helpful so that they're not so anxious about their risk of breast cancer. If you are at higher risk for breast cancer, we can figure out if you need genetic testing, we can arrange for the increased screening, we can have physical exam done by a breast practitioner once a year for you. Of course, if you're at the highest risk for breast cancer, so there are the people who have gene mutations who have a really high risk of breast cancer, we can also talk about prophylactic surgeries and things we can do to really reduce your risk. Also, if you are one of those people who have a gene mutation, sometimes they tell you that you have a risk of other cancers, and we can certainly help to connect you with other programs at Roswell that could help to screen you for those cancers and or help reduce your risk as well. Obviously, if you develop breast cancer, we can seamlessly transition you to our breast cancer clinic as well, where we have all the resources of radiology, pathology, radiation medicine, chemotherapy if needed, to be able to help you.